Welcome to the panel on Big Tech and Digital Health. I'm particularly delighted to be moderating this panel because this issue of what role big tech should play in our public healthcare system has become much accelerated since the pandemic. And we've seen over the last few months, Walmart open up its parking lots and make them drive-through testing sites. We've seen Microsoft help develop a symptom checker app for the CDC. We've seen Amazon deploy thousands of Amazon Echoes to help healthcare providers communicate seamlessly and remotely with COVID patients. There's a huge amount going on in the big tech space with COVID, but it hasn't been rosy entirely. We saw one major tech company kind of rush in to deploy an online screening and triage system to help get people tested. And in the initial rollout, it was open only to people who could speak English, only to people who were American citizens, only to people who had certain kinds of email accounts. And it raised larger questions about what are the risks of having big tech be the gatekeepers to Americans' healthcare. So I am delighted to introduce our expert panel who are going to field some of these tough questions. We have Marcus Osborne from Walmart. We have Dr. Jim Weinstein from Microsoft. We have Dr. Michael Mina from Brigham Health. And we have Amanda Goltz from Amazon. So to kick us off, Marcus, I was hoping you would talk about why are we seeing an increased role of giant corporations during the pandemic, and how should we think about the role of big tech in US healthcare?
Well, I'd argue that we're actually, it's not specific to the pandemic. I think you're seeing big technology corporations play a role in the emerging healthcare system in the U.S. I think in largely due to the fact that if you compare the U.S. Structurally to say countries in Europe or even some of the developing countries, we don't really have a public health infrastructure, and so in many ways, as we look as communities and individuals and families grasp for healthcare needs, they're not finding public health infrastructure that exists at any kind of significant scale, and they're certainly struggling at times to get it from the traditional healthcare sector. And so I think what we're seeing is a lot of these large tech companies, and I actually I think our CEO would be proud. Our CEO views Walmart as a technology company, not as a retail company. And so companies like Amazon, Walmart, Microsoft, Google, Facebook, and others, I think, play a big role of really doing what in other countries, the role that is performed by the public health infrastructure. And so when you think about things like, you mentioned it earlier, groups like Walmart and CVS and Walgreens doing parking lot diagnostic screening centers, or you think about Microsoft or Google standing up online assessment tools, and Amazon as well. I think that's all sort of, we can play that role because of the access we have, where, in any given week, more than half of Americans come into a Walmart. In any given week, 80% or more of the searches are being done on Google. In any given week, how many individuals are going to Amazon or engage to access retail solutions or other services, or how many people are engaging Microsoft tools, or how many people are using Facebook and social media. That access is enormous. And so I think it puts us in a unique position to have an impact on those communities in a way that is difficult for the existing structures to do so.
And Jim, would you like to weigh in on that, given your position there at Microsoft? What are the opportunities for big tech to help in public health? And considering your background coming from academia and research and medicine, should there be some kind of limits? What are the risks also of letting big tech flex its muscles in our kind of public health system, where, as Marcus points out, we do lack a lot of infrastructure?
Yeah. Well, thanks, Natasha. I think Marcus hit a lot of key spots. Obviously, we enjoy our work with Walmart and many others around the world in this issue. I think the issue of public health has been underrepresented in the tech space. I think technology is fantastic, but if we can't talk to each other, We can't communicate the appropriate data. So at Microsoft, like other tech companies, we've been looking at issues like interoperability. I think when you think about the robots or chatbots that you alluded to with the CDC or FDA, we've had 3 initiatives that have been just remarkable to bring the world together with COVID. We've tracked with our tracker for ruling out COVID, nearly 40 million patients around the globe. With the FDA, we're looking at helping on clinical trial enrollment with these bots. On convalescent serum, where we may be able to give people other people's immunity to help people be cured from this disease, potentially a chatbot to help screen that. I think the world of computer technology and digital is here to stay. What I worry about is that as we build new highway lanes to decrease the congestion, we don't create more and don't get rid of what wasn't working. And so, what I worry about, do we build telehealth, but also continue the bricks and mortar healthcare and just continue to raise the price? So I think the challenge is, how do we move away from the old into the new while we try to take on the challenges, in this case, of life and death?
Well, that's a great segue into Michael. I'm really interested from your vantage point within the health system. What kinds of things could big corporations help with? Particularly, we're seeing things like supply chain issues with PPE, lack of reagents, lack of swabs. Are there non-digital things that would be helpful, perhaps more helpful than digital solutions right now?
In the current climate, and with regard to this particular pandemic, absolutely. One of the greatest challenges we've faced from a testing perspective, which has of course been on the front page of New York Times and every other major media outlet in the country, has been the limitations on testing. And this has been driven. It was initially driven by limitations on the actual facilities to perform the viral testing, for example. But very quickly, it turned into supply chain issues. Even just getting the nasopharyngeal swabs turned out to be an incredibly difficult task, and actually continues to be a very difficult task. And we've seen US laboratories, even in individual laboratories like ours at Brigham and Women's Hospital, starting to work directly with manufacturers overseas in China to try to get swabs, for example, into the US, only to have them held up at customs and at the border. And this has actually led to very long delays in getting testing performed across the country. So certainly, I think some of the real benefit, the physical, tangible benefit that could come from the types of connections and infrastructure that major companies like Walmart and Microsoft and all these other massive companies that run this country in many ways, I think that they have the supply chain systems that are set up could actually make a huge difference, and have made a huge difference throughout this. And so it's been one of the major benefits, and having those types of links has been crucial. There's also the role, I think, very much for these large companies that have a national or even a global reach, to use that reach beyond just the physical entities that absolutely need to be put in place, but the data that exists within these companies can be harnessed, I think, as you're hearing, for in exceptional new ways to really be able to monitor and track this epidemic and be able to help contain and control it. And so it's been very heartening to see a tremendous amount of new collaborations formed as a result of this epidemic. And we've seen academia and industry, I think, partner in ways that have been attempted in the past, but it's really on supercharge right now. And I think that that's been a very good barrier to start breaking down more and more.
Well, that's a nice segue also into Jim, who I know wanted to talk about the role of data. Unlike a lot of other countries, we do not really have a national database of patient information, partly because as a country, we worry about security and privacy of individual Americans. Can you talk a little bit about what the opportunities are for data to play a role, not just in this crisis, but going forward?
Sure. As you know, Natasha, I spent most of my career studying the US healthcare system at Dartmouth and studying variability of healthcare and trying to work across systems in the country to create a data stream that allowed us to solve some of the biggest problems. So sepsis, which kills about 250,000 people a year in America, we set up a collaboration with a common data set. We were able to cut the mortality rate from about 55%, meaning 55% of people in the hospital never went home, to about 10% in my own hospital within about 3 months by just sharing data and communicating. So I think that's just an example. A lot of people with COVID die in a septic state, where if we could share the data, simple things like in sepsis, it's IV fluids, it's antibiotics, and it's serum lactate levels. In COVID, it's early testing, early intervention, trying to get to people before they get onto a ventilator. Sharing that data across the system in an architecture that allows for interoperability of common data elements, which the CDC is trying to organize and we're trying to support, is critical to the future of this country. So there are data elements that we agree on. There are tools to allow that data to flow through APIs or interconnected data streams with interoperability that would allow us to have much more information faster that I believe in this case potentially could have gotten upstream to at-risk populations to save lives.
And Amanda, another big trend we're seeing is that tech companies are finding that the tools they already have can be used in innovative ways to help the public health system. And I was hoping that you would talk a little bit about Alexa and the devices you're deploying to medical centers for this.
Absolutely. So we're focused on my team on where we can be most helpful in this crisis. And what we're working on now is donating the Alexa Show device to hospitals so that a nurse or a clinician can use that device to drop in on another device at the bedside of the patient. And what this does is it allows that clinician to respond to the patient's request on a nurse call or to check an alarm that's going on in the room without having to glove up and use an individual protective or personal protective equipment before going into the room to avoid that risk of infection exposure and also to save that precious PPE as long as it's in shortage. And we've gotten we're really humbled actually by the feedback, the anecdotal stories that we've heard from the hospitals that we're working with on this initiative in how helpful that is, not only in saving personal risk and also conserving that equipment, but also that the devices are relatively easy to use, that they were able to adapt to them and use them for their intended purpose and speak to the patient, see and hear them, because that personal touch is so important without a lot of ramp up or learning period, which nobody has time for in a crisis. So we were really gratified to hear that, and we're glad to be helpful. And we've actually set aside $5 million in devices to hospitals and other entities who need those devices.
And does that make you think differently about how the Echo could be used in healthcare going forward?
We're excited to learn, not just from this deployment, from any way that people use our devices. We really sort of serve up what we think will be most useful, and then we learn from our hospitals and everyone we collaborate with to understand, how is this device useful? Where does it perform really, really well, save time, save effort, save personal risk? And that really informs our thinking for the future. But we're very much in a learning posture. We donate these devices, we help set them up, and then we just try to learn from what the hospitals are doing.
And Michael, the FDA over the weekend authorized the first antigen test. And we've seen other recent changes about home use. The FDA recently approved self-swabbing kits at home for nasal swabs for COVID. And then on Friday, the FDA approved these kind of saliva tests that people can collect their own samples at home. I read you recently talking about how you envisioned a future where people might be able to go to the store and get a packet of antigen tests like pregnancy tests and take them home and take one a week. And I'm really interested in how you envision large corporations like Walmart, like CVS, like tech companies playing a role in the consumerization or more ease of access to testing.
Yeah, I think certainly at-home testing is the future. I think in fact, even pre-COVID, there's this practice of people going to the physician and talking to their physician, and only at that point getting their blood drawn. And so then all of the crucial data that comes from their laboratory studies is brought to them only after they've had their appointment, in many cases still. And so I think COVID or pre-COVID, we were seeing a need for at-home testing, or at least testing that can be brought to the consumer before or in the absence of seeing a physician. And I think some of these companies like Walmart, where there's a physical presence that would be potentially appropriate for getting either blood drawn, or for the distribution and sale of kits that could be either ordered by a physician or distributed in a wider sort of way. This idea that only physicians can order tests, I think, can potentially change in the future, where maybe there should be a new model for how tests are deployed and how people can interpret their tests. So I think that there's a big role for these types of companies to distribute these, and also help, for example, the Microsofts and Amazons. I see a big role for helping to interpret with the patient what those tests are. Do you necessarily need your physician to help you interpret an influenza test, or could it be a more distributed system where you can get on the phone if you choose, or on an Alexa device or something like that, with a clinician standing by to help you make sense of what to do with the results? So I think that these can really start working hand in hand, especially as testing becomes more available outside of the central laboratory. These types of
Michael, we only have a couple minutes left, so I want to just throw out a similar question to the other panelists, maybe starting with Marcus and Jim. What kind of things have you learned through the crisis that might be applied later, whether it's the next wave of the pandemic or for other health issues going forward?
Well, I'd echo Dr. Mina's point, and I think I don't know that we've learned. I think what COVID has reinforced, an opportunity that I think that we as a market have missed, which is exactly that consumers are actually wanting to get information about their health right now, and that the idea that I need to go to the doctor, to someone who delivers care, to get lab or diagnostics run, and I don't think this applies just to COVID. I mean, I'll share. I mean, certainly the opportunity to say, for my child, if do they have flu or do they have strep? Why do I have to go to the doctor's office to figure that out? Why can't I sort of do it in my home, or why couldn't I go somewhere much more convenient to very quickly figure it out and then go figure out what the best path forward is? But we use the example of Walmart Wellness Days, which were more designed around chronic disease, and this idea that for free people could come in, and we coordinated 4 times a year across all of our stores, and you could come in and get a blood pressure or a BMI or a cholesterol test or a glucose test or an A1C test. In a 4-hour period, we in the last Walmart Wellness Days that we've done, we will do over 400,000 full health assessments. What that tells us,
scale.
yeah,
and I'm wondering
what
also,
that tells us is that people actually that we have done a disservice, I think, to consumers on not allowing that diagnostic and lab piece to be up front and more accessible. And so I think I think COVID has just exposed that, quite frankly.
And Jim, to wrap us up, do you want to talk about also the kind of things that Microsoft is learning going forward, and the notion of how scale could play a role in really making changes in innovation in the healthcare system?
Here, Natasha, I want to be sure that we don't leave people behind. As we get to this digital economy, which will be a big part of our future as a globe, not just the United States. What we're talking about, I think we have some great colleagues on the phone here with this talk, but we want to move the curve to the right so everybody can get better. What we've seen in this case is we still have these inequities that leave people behind. So what I think Microsoft and other companies need to do is we make these advancements with bots and other technologies, that we make them available for everybody, because we have the most vulnerable populations that we tend to have greater and greater disparities. And so I think Microsoft's confident in its digital abilities to connect the world in very short times and has the capacity to do that at scale, but we can't leave people behind. So we have to be very thoughtful about how we move technology forward in the next generation and the generation after that to narrow the gap of disparities, which we still haven't done.
Well, thank you, and thanks to everybody. And I want to thank the panelists, and I want to turn it back over to Chris.